Welcome back to the news wrap. The American Red Cross is calling on the public to roll up their sleeves to help with a severe blood shortage in hospitals all across the country. The organization says if Americans do not step up to donate blood, it could impact critical patient care very soon. Joining us now to discuss more is Red Cross medical expert Dr. Ross Herron. Dr. Herron, thank you so much for joining us. Hospitals, as we mentioned, all over the country scrambling right now. What can you tell us about the driving force behind these blood shortages?
The demand for blood is really high. It's at levels we haven't seen it in the recent past. I mean, we're comparing to like 2019 or 2020 before the pandemic hit. We're at levels somewhere between 8 and 20% higher than what we were seeing previously. So we're collecting a lot of blood, but it's still not enough to meet the demand coming out of the pandemic.
How much blood supply would you say the American Red Cross typically has in store compared to what we're seeing with the shortages right now?
So we try to keep about 3 to 5 days worth of blood on our shelves. And for the hospital shelves, we try to keep somewhere between 5 and 7 days if possible. So our shelves currently for O positive and O negative red cells and for B positive and B negative red cells, we're at either a day or just over a day to start the day. And by the end of the day, we're down to maybe a quarter of a day's supply or less. Sometimes we're scraping the bottom of the barrel just to try to make it through.
And I just want to clarify here, the levels that you typically keep, you mentioned that 3 to 5 days of blood. Is that just because of the pandemic and COVID-19 response, or was that also pre-pandemic levels that you were hoping to obtain?
Yeah, that's pre-pandemic. That's what we try to do. But if we can have 3 to 5 days supply and the hospitals have 5 to 7 days supply, that allows us some inventory wiggle room so that if we do have a short-term collections problem for like weather-related collections where we can't collect in an area where it's having tornadoes or hurricanes, something like that, we still have enough buffer that we can make it through the short term. Now this seems going to be like it's going to be a longer-term catch-up because we have all those patients coming back after the pandemic trying to get their surgeries that they need to have done, and they're doing them now. So we have a big bolus of patients coming through. Also seeing some more traumas than we have in the past, and organ transplants have also become very brisk, and those also use a lot of blood to be able to accomplish organ transplants.
Doctor, I'm so glad you mentioned that. It brings me to my next question. You added about the organ transplants. What other crucial patient care and surgeries have to be put on hold during this kind of shortage?
Well, so things like if say you had cancer, right? So and you need to have surgery to get your cancer removed. You don't want to postpone your cancer surgery because the cancer will grow and potentially could then spread. So that's sort of a semi-elective procedure. We really can't wait for that to occur. And so that kind of thing, we don't want to postpone those surgeries. If somebody's having a knee replacement or hip replacement, and they can perhaps postpone that and until we have a larger blood supply down the line. But other things like gastrointestinal bleeding. We see a lot of people coming into the ERs these days with gastrointestinal bleeding. Some of it related to alcoholic cirrhosis and alcoholic hepatitis, etc. So those we can't wait. You need to have blood for those kind of procedures. And hospitals, of course, don't want to have elective surgeries be postponed because they have patients in need as well. So it's important to get those products available so we can provide the care that the hospitals need to provide to the patients.
Earlier on, we noted this is an issue that we're seeing across the U.S., but are there specific states that are experiencing the lowest supplies of blood right now?
Well, American Red Cross has a national inventory management system. So if for instance, we have a hurricane in Florida or in the East Coast, and we have some blood drives canceled there, we'll be able to offset that by moving our inventory around and having about a constant level of sites, our distribution sites at a constant inventory level. So we share inventory across our national system. So if there's an area that's using more, like for instance, California is very brisk right now, we would receive more from the rest of the country. We're also collecting very briskly in California at the time. So, but we do move it around to make sure that we have it available in our system wherever we need it. We have patients in need.
When it comes to the shortage, I also wonder, is there a specific type that people should know about that there is especially low supply of, or are you just looking for donations across the board?
Well, we like to have donations from new donors come out across the board. In particular, though, we are having the biggest deficit we have is O positive, also then O negative blood donors. And then anybody can donate platelets. Platelets can be transfused across blood types. So we have platelet-pheresis donations that also need to be made. Those are collected a little differently than whole blood donations. Are collected by an apheresis instrument. Takes a little longer to do. It can be done more frequently. But those platelets only last for 5 days on the shelf. And so it's hard to have an adequate inventory. It's almost a just-in-time inventory of platelets that we deal with.
Dr. Herron, I don't know if this is necessarily related to the supply issue, but I wonder if there's something that viewers should be aware of. We know the vaccine rollout is underway. Does that at all make any changes to the protocol in terms of the blood that you're able to accept? Should viewers know anything in terms of their health during this pandemic?
The vaccine is not a cost for deferral. The vaccines that are available for use in the United States are all acceptable for donation after you've been vaccinated. It doesn't cause a problem at all. You don't even have a waiting period for that. So that would not be a reason not to come in and donate. During the pandemic, the Food and Drug Administration made some small changes to donor eligibility to broaden the eligibility for some donors. In the long run, it's not that much different than what we had seen previous to the pandemic. So if you're healthy, age 16 with parental permission, or 17 and above, then come in and donate if you don't have risk for HIV or hepatitis risk. And if you want to know how you're eligible, you can always go on to redcrossblood.org, and we have our health history questions there that you can check out.
And again, if viewers are interested and want to make sure they're donating blood during this time, where can they go and find more information?
Okay, so one of the best places to go is to the Red Cross Blood Donor app, which you can get from the Google Play or from the iStore. And so a lot of the new generations, the younger generations, like to use the app to make their appointments. Also, redcrossblood.org online. You can make your appointment that way. Look for a convenient date and time. We want appointments so that we can make sure we have adequate staff there and also control the flow of donors coming in, as some states are not completely open yet relating to COVID-19 pandemic. So that's the way you can make your appointment. If you're more old school, you can also call 1-800-RED-CROSS and make an appointment that way. We have folks waiting for your call.
Thank you so much for coming on the show and highlighting this really important issue right now. That's Red Cross medical expert, Dr. Ross Herron.